1 month from now, the youngest group not yet eligible in the U.S. could line up for the COVID-19 vaccine. Today, Moderna asked the FDA to approve its vaccine for children as young as 6 months old.
Angelique Arentalk spoke with a local parent who's hopeful the shot for her child who's at high risk of severe illness.
Moderna requested emergency use authorization for its COVID-19 pediatric vaccine. If approved, children 6 months old to 5 years old can get a series of 2 low-dose shots.
The process for getting vaccines for the youngest children has kind of been 2 steps forward, 1 step back, 2 steps forward, 1 step back.
Catherine Kane of Chesapeake is eagerly waiting to get her youngest daughter vaccinated against COVID-19. 3-year-old Ava has had airway reconstruction and is in the high-risk category.
We are all still masking in schools or when in crowded public places, and we are still kind of holding off on things like extracurricular activities and big crowds.
Leaders with Moderna tout, quote, good production of antibodies. They also say 2 kid doses showed 40 to 50% efficacy at preventing symptomatic illness.
It would protect her against severe disease, and that is our biggest concern for her.
Cindy Williams of Riverside Health anticipates a much higher efficacy rate at preventing severe cases and death.
They do still have additional data they need to put forth to the FDA, which they hope to have submitted within the next 2 weeks.
Before taking a vote, the FDA will review and meet. The CDC would have to give the final green light.
Probably fastest path is about a month from now.
Despite the CDC's estimation that 3 out of every 4 American children have been infected with COVID-19, Williams says you can't rely on natural immunity alone.
You could have had Delta, for example, and you have no protection against Omicron. The vaccines, at least for serious illness, seem to be covering variant to variant, even though the efficacy may be slightly less.
413 News Now, I'm Angelique Arentalk.
Pfizer is also working to get its vaccine for younger kids approved. It currently is conducting more studies on its version for kids under 5. The company could present new data in the next few weeks.